And so when that happens, you will get a lot of positive patients. And when you get a positive patient, you obviously have to test all the people who've been in contact with that person. And so you will find more positives. That applies everywhere. It's not restricted to any one problem, because that's the strategy we adopt. In the particular case of the Western Cape, it seems that at this stage, from my somewhat limited knowledge, because as I say, I'm not on the ground in the Western Cape, I don't want to pretend I understand it in any great detail. But from what data we have seen, that the initial infections occurred in people who were going to places like grocery stores and supermarkets. And those were open anyway and were functioning during the lockdown. And from those, there were infections that were seeded and spread amongst the staff, and then those may have spread on from that point. Now, the problem is that by the time you know about an infection, this person has often already spread it to others, because spread occurs while you're asymptomatic. So it's not like there's anyone to blame. It's simply a matter of that's how the virus spreads.
I see. All right, we are all waiting to be told that we're definitely moving as a country to lockdown level 3. I mean, it's like a crazy game we're all playing at the moment. I have two questions in one. First of all, do you feel that we are ready as a country to move to lockdown level 3? And secondly, we have seen in other countries when the pandemic peaks, which we're expecting here around August, September, they push into a hard lockdown again. So, are we ready to go to lockdown level 3 now? And do you expect us to lock down hard later in the year when the pandemic peaks?
When we look at the overall levels of community transmission in South Africa, as a whole, in most of the country, community transmission has been fairly stable over the last little while. And that applies whether you look at tests done in hospitals where patients are symptomatic and we're looking for cases, or whether it's in screening programs. Particularly if you look now at patients who are being tested in hospitals based on symptoms, we have to do quite a few tests in order to find a positive individual. So we know that from symptomatic patients coming into a hospital that our levels of transmission in most of the country is at a low level. In the Western Cape, the situation is different, but for the rest of the country, that certainly is true. Community transmission is one of the indicators that could be used to define what sort of strategies we should be aiming for. And I think overall, we need to be moving to a stage where we are using the full combination of all our strategies. And the lockdown needs to be just one of those many strategies. In terms of whether the country is in a position to move down to a lockdown level that's lower than what we have now, that's a decision made factoring many things into consideration. If one looks purely at one of those factors, community transmission, I would say the answer is yes at this point. But it's not going to be like that for long, because transmission will likely increase in various parts. And we have to also be prepared that we expect a surge in a few weeks' time.
So you're saying we could go later this year into a deeper lockdown again to try and control transmissions if they spike really high?
I wouldn't say that it's axiomatic, because it just depends on how we behave. Let me explain that. If we adopt the current strategies of social distancing, wearing our masks, hand sanitizing, being very careful when we go to the shopping malls and in the way in which we go into public transport, we could be in a situation where we will have a much lower peak than the ones that are predicted. It's in our hands. If we choose not to follow those rules, we can expect that the peak might be even bigger. So it's up to us to determine how this peak will occur. Regardless, I think that the lockdown should be really a last-ditch initiative. We need to look at how we're using the other combinations of our prevention strategies and use all of them in the best possible combination to make the community transmission rates as low as possible.
Well, thank you very much for your time. We really do appreciate that. Is Professor Salim Abdool Karim coming to us live from Durban this evening.